All right, welcome everybody who is just joining us from the waiting room. It's so wonderful to see all of you here. I can see that we're going to be inviting people a little bit as our session goes on here. Before we get into the panel discussion, I just want to very briefly introduce myself and our panelists today. So I'm Dr. Marie Hollowaychuk. I am the CEO and founder of Reviving Veterinary Medicine. We have many different resources and services all aimed at improving the mental health and wellness of veterinary professionals around the world. You'll see we have worldwide representation based on the coaches that we have here, and I'll dig into some of our offerings later on. But before I do, I want to first go ahead and introduce you to our panelists. So we have Dr. Helen Allwood. Helen is a small animal vet turned coach and trainer with 15 years of experience. Helen is passionate about neurodiversity in vet medicine after her own ADHD diagnosis. She also specializes in leadership, career transitions, and coaching neurodivergent team members. She's an ICF accredited coach and is completing a postgraduate certificate in business and personal coaching at the University of Chester. We also have Julie Morse Elliott. Julie is dedicated to supporting veterinary professionals in managing stress, burnout, and well-being. With a compassionate, evidence-based coaching approach, Julie helps individuals build resilience, improve communication, and navigate career challenges. Julie also empowers veterinary team members to cultivate emotional intelligence and rediscover their passion for a sustainable, fulfilling career in vet medicine. We are so grateful to have Julie as one of our coaches and panelists today because Julie is also working towards finalizing her counseling. I don't know what to call it, accreditation certificate. What you'll fix it for me later, Julie. I was like, I don't know what the exact phrasing is, but going on to becoming a certified counselor. Next, we have Kira Valentine on the panel. Kira also has a mental health background and certification. She's a licensed clinical social worker and certified vet tech with over 2 decades of experience in emergency and critical care settings. More than half of that time has been in leadership roles. So with this unique blend of clinical expertise, nonprofit leadership training, and mental health qualifications, she brings a very holistic and compassionate approach to her work. Kira specializes in grief and loss support, leadership and veterinary management coaching, and career development for vet professionals at all levels. And then finally, last but not least, we have Sophie, Dr. Sophie Gilbert. Sophie is a compassionate veterinary surgeon and qualified executive coach who focuses on emotional resilience, career fulfillment, and sustainable life balance. She's got decades of experience in primary emergency care practice, and she brings a deep understanding of the unique pressures that veterinary professionals face, as well as a heartfelt commitment to helping others in the field thrive. So we have these incredible coaches. I'm very excited to get into the episode. I do have selected questions for my panelists to answer. So we are going to go ahead and get into those. And if any of you who are joining us here live have your own questions that you would like to ask any of the panelists, please do feel welcome to pop those into the chat, and I will be looking for those as well. Okay, so I'm going to get started with our first question. And this question is, okay, we're going to jump into our first question, which is, what is the difference between coaching and counseling, and how can someone determine which is the right fit for them? So Kira, I'm going to send this over to you to begin, please.
Yeah, it's such a good question to start the panel with because it's really an important differentiation. There's a lot of overlap between coaching and counseling. Both fields are there to support people in their individual goals and where they want to move forward in their personal growth. I kind of liken coaching to when you're managing, you've got things going, you know where you want to go, but you just need a little extra support. You need that extra encouragement. You've got some challenges that you need some help working through. When my work as a coach, I work with leaders. And I think when I first became a leader, I didn't realize how lonely it was at the top. So just having somebody to bounce some ideas off of is really helpful. But I see counseling more as when those challenges are actually impeding your day-to-day life and you're having trouble getting through your normal routine and you're feeling like you're not living your life fully. That's probably more of a deeper issue that counseling would be more effective for.
Awesome. Thank you so much for that. Sophie, what would you like to add to that question as well?
Yeah, it's a really, really interesting question, and I think we could almost spend the whole session talking about this in some ways. I would agree with Kira. I think from a coaching perspective, I think generally the momentum tends to be quite forward driven. So we're thinking about the future often, whereas I think often in the context of counselling, you may be looking a bit more to the past and what barriers you found in the past and trying to overcome some of these and sort of dig deeper into some of those bits that have caused you barriers in the past. With coaching, it's definitely, like I say, a bit more of a forward propulsion. It's looking for change, it's being ready for change. So I think with coaching, often what we're sort of aiming to do is try and give you that clarity in where you want to go, give you that confidence in to getting there, and then the accountability to following that through as well. So it's quite goal directed. I would agree, though, there is a lot of overlap. And actually, sometimes what we find with our coaching clients is that the barriers that exist to us moving forwards come or are created sort of in our past. And actually, they're mental barriers that we need to overcome. So sometimes there is that overlap in we need to look a little bit backwards to move forward sometimes. In terms of what's figuring out what's right for you, I think that's a really individual question and one that's quite challenging to answer sometimes. I think sometimes it can come down to the individual. Like Kira said, where that individual feels they are in their journey. Are they ready for change, or are they more thinking about overcoming some challenges that they're still dealing with from the past? And sometimes a balance of coaching and counselling might be what's right for you as well. Sometimes a bit of both is really helpful too. So yeah.
Awesome. Yeah, that's very, very helpful. Thank you so much for your insights there. Um, I'm wondering as well, when we think about coaching versus counseling, there's a difference in terms of the scope of practice when it comes to coaching, I should say, I almost put the two together, coaching, versus counseling or therapy, right? So as counselors and therapists in the group, Julie and Kira, I'm just wondering, when you think about that scope of practice, where does that line where does that line end up being?
I'll jump in here.
Thank you, Julie.
And so, just to clarify for everyone, I guess, Maria, as you said, to clarify what I'm doing and all of my credentials. So, I am an RVT, also with a VTS in emergency and critical care. I have actually completed all of my schooling for counseling. Where I'm sitting right now is just being in a place of still having supervision. My credentialing has changed due to different provincial regulations that are coming into play. I was originally a registered professional counselor candidate, now master practitioner in clinical counseling provisional. So that's the change there. And I am a practicing counselor. I have my own private practice. So the line between coaching and counseling, where would that line be drawn? Just kind of want to reiterate what Sophie had said about coaching being within the present, counseling being more into digging into the past. So if an individual is finding themselves really struggling with things that have happened in the past, wanting to dig into that history, I think that's a big, line in the sand, that's, going to be more something that you're going to work towards with a counselor versus with a coach. I would say if there's anything relating to trauma, if there's, anything around that aspect as well, I think that line is going to be very defined and more of work that would need to be done with a counselor versus a coach. And then I'll let Kira jump in here as well.
Yeah, I absolutely agree with the issue of if trauma is involved, it should definitely be referred to more of a counselor for digging deeper into why we have the responses that we do and the reactions that we do. Where a coach would actually be able to help you figure that out as well. Like if you start with a coach, they should be able to refer you if it is out of their depth.
Awesome. That's super helpful. Julie, I'm going to turn it back over to you and just ask, what are some of the common signs that someone might benefit from working with a mental health professional? If we, back things up, I know that we've, delved into right from the jump, the difference between the two, including scope of practice. I can imagine, and certainly a lot of people come to me and they say, I'm thinking of talking to someone, like, how do I know if it's time? Like, how do I know if it would be beneficial? What do you generally see in your own clients and then also suggest to look for when you're advocating for mental health support?
Yeah, absolutely. I mean, I have quite a long list here of different things that may be coming up and things that could be noticed, and just keeping in mind that these signs can manifest in various ways, and that really there is an importance in recognizing them to be able to work towards seeking that support or recognizing like that you may need that support. So emotional exhaustion, that feeling of feeling completely drained, overwhelmed, emotionally depleted after a long day of work. If you're noticing yourself or even coworkers as well, I mean, I think that's important to input here as well. That those that you're working with and colleagues recognizing these different things within one another, is that increased cynicism or overall detachment. So just developing that negative or cynical attitude towards the work, the clients, the animals, or feeling emotionally detached just from the job itself can be indicative of burnout, right? So those are some things that we may see. Overall difficulty managing stress. So just struggling in general to just meet the demands of the job, such as high caseloads or emotional situations that are coming up and developing. Changes in sleep patterns. So if you're noticing that you're starting to have insomnia, frequent nightmares that are coming up, or sleeping excessively as well can affect that overall well-being and may warrant some attention. Changes in appetite or weight, so noticeable changes in eating habits or significant weight loss or weight gain can be linked to that stress or emotional distress. Withdrawal from social interactions. So pulling away from your colleagues, pulling away from friends and family, and just losing overall interest in social activities, difficulty concentrating, finding it hard to focus, making decisions, particularly in the high pressure environment that, we're all familiar with and work with, that overall just mental fatigue. And then physical symptoms can show up as well. So headaches, GI issues can sometimes be linked to stress and anxiety, substance use, reliance on alcohol, medications, or other substances to cope with that stress or emotional pain that's coming up. And last, but certainly not least, is feelings of hopelessness or worthlessness, right? That persistent feeling of sadness, can be indicative of depression. So any one of these, all of these, I think, really, really come to the forefront in being able to recognize those and really indicating that you may be needing to reach out for help from a mental health professional.
Yeah, this is so helpful. And, as an advocate and educator in this space as well, I think it's important to highlight that, so many of these signs, yes, can indicate, a mental health challenge or a mental illness. You mentioned depression and so on. And there is so much overlap between those signs and burnout or compassion fatigue or some of these other things that we grapple with so commonly in vet medicine. And this is where I think it's important to recognize that coaches are not mental health professionals, and we are not able to diagnose. And even many mental health professionals, as we can also explain, are also not diagnosticians. They're there to counsel, to guide, to shed light, aid self-awareness, etc. And so, I think lots of times people will try to self-diagnose and determine what their experience is. But really, unless you're connecting with a mental health professional, it can be challenging to know what to do or what is actually happening. And so I love this that you've listed all of these symptoms and really just put it out there to urge people. If you're not feeling like yourself and you don't know where to start, connecting with a mental health provider is a incredible starting point. And thankfully, many more of our practices and vet med associations today have free employee assistance programs to support, especially just even that crisis or that initial assessment by a mental health provider. I'm going to switch gears and just connect with the coaches for just a moment, and wondering if we'll turn it over to Helen to start. If you can describe the different types of coaching that exist. I think people hear about coaching and, I don't know, decades ago when this kind of first started, it was life coaching, career coaching. Helen, maybe you can share with us the different types of coaching that exist and how they support well-being, and then we'll turn it over to Sophie.
Yeah, so I think how long's a piece of string is how many different types of coaching exist. There's kind of loads, and as you say, life coaching was an early one, leadership coaching, wellness coaching, my own particular niche, neurodiversity coaching. And I think there's so many there that the difference is about the goals really that the client comes with. So do they want to, assess their career path? Do they want to explore their neurodivergence, for example? And my personal view of it is that if you actually get into the meat of the session, there's so much crossover. You often end up talking about similar themes. So with my ND clients, for example, I'll often discuss their career path or their leadership journey, for example. And we all have specialisms, coaching specialisms, which is really useful when a client's trying to navigate their choice of coach. But the common thread for me with all of this, and I think the thing that really supports well-being the most is our self-discovery. For me, coaching is a real journey of self-discovery. And I think you can really very well get to know your inner workings through coaching. And that, for me, once you've done that, that can breed self-compassion, which is obviously massive in terms of well-being. So that's where I sit with it.
I love that. Sophie, what would you like to add to that?
Yeah, I absolutely echo everything Helen said there, actually. I think it's very easy to think that we can divide our life into these different portions. So, I'm, struggling with challenges at work at the moment, or I'm feeling a bit unhappy with work. But actually, the reality is that each part of our life doesn't exist in a silo. Our personal life at home impacts our work life and vice versa. So everything we do actually is all interconnected. And I think Helen sort of really touched on that beautifully, that yes, there are some areas in which coaches may be particularly sort of interested or specialized in those areas. But actually, the way most coaching relationship works is that you end up touching on various parts of your life, and you might actually discover something. You might be thinking, it's just a career change I want to think about. I just want to go and talk about this career change. But actually, you end up sort of opening up doors and talking about things that might be to do with other parts of your life. So whilst I think there are lots of different sort of specific types of coaching, I think they all overlap. And again, as Helen said, I guess the point of coaching across any form of coaching that you do, the base part of it is to form a more positive relationship with yourself. It's to develop that level of self-awareness. It's develop that self-compassion for yourself. It's building resilience, and that might be across your life or across your whole life. That might be specifically within work, whatever that looks like. And improving your skills to navigate change. And within all of those things, that's never going to be, as I say, that's never going to be sort of siloed to one particular area of your life. Yes, you can improve your skills in navigating change at work, but that's certainly going to help you with your overall life and personal relationships and things as well. So I think it's important to recognize that there is that sort of whole holistic approach to everything, for sure.
Yeah, those are really great points, Sophie. I'm going to stick with you and just maybe give a little bit of clarification to those who are watching and listening. What does a typical coaching relationship look like in terms of structure, goals, and outcome? And we'll kind of cross-reference that with counseling or therapy afterwards, but maybe you can start with coaching.
Yeah, absolutely. And I think that's really interesting, the way that you've posed that question, because actually generally coaching relationships are quite goal oriented. We're looking to achieve something. I would say the coaching relationship tends to be broken down into, I guess, four main parts. You've got your initial kind of discovery part, where as the client and the coach, you may have an initial conversation about what the client thinks they might be looking for. You might be looking at whether you think you're a right fit, because ultimately you can choose a coach on paper, but actually the point of the coaching relationship is that you feel able to sort of trust that person and open up to that person. So if you don't feel that you're the right fit, then that's, absolutely fine. And it may be that a different coach is appropriate for you. So I think in those initial conversations, it's really important to understand whether or not you feel that you can trust that person, start building that initial relationship. If you feel as a client that you want to continue past that initial discovery phase, then you would go on to, I guess, what we would call the planning or maybe the contracting phase. So that's defining the boundaries of your relationship as a coach and a client. So that's talking about actually, what does this look like? How long are the sessions going to last? How often do you want to have these sessions initially? How does that work for you? Is that online, face to face? All of these sorts of things that sort of outline those boundaries. And then also specifically around sort of confidentiality and how that works, ensuring that you're both comfortable with that sort of contract, whatever it is that you're drawing up with each other as your coach and client. Once you've sort of got all of that initial stuff out of the way, I guess you can move into the actual coaching conversations and the coaching part. And that can look different depending on the client, because the client will arrive, I guess, as the person who's looking for the coaching, they might arrive in different places. So you might have somebody that arrives, I might have somebody that comes to me for coaching and they have quite a clear idea of what they want to achieve from the coaching. And if that's the case, as a coach, sort of you start from that perspective. Okay, well, you've kind of already got your goals. So now we're going to talk about how we can break that down, how we can put in things to support you to, actually turn those goals into actions, and that sort of thing. Equally, you might have somebody who sort of comes and says, I don't really know what I want to achieve, but I think I need some support. So the initial part of those coaching conversations might actually be about digging down and trying to figure out what that person's goals, what that person's outcomes sort of look like. So it sort of depends a little bit where you start. With any coaching sort of conversation or with any coaching, I guess, agreement, ultimately the aim is to support that client to achieve those goals. So whatever point that you start on, it's a bit like a sort of a circle. You find what your goals are, you have discussions, you break that down, you set in your action points, and then as you continue through, you review those action points, you look at that accountability to see how things are getting on, and you review where you're at. And then it's that review part that sort of closes that loop, I guess. And the review can look like, okay, great, I've achieved those goals. This is the end of this coaching kind of piece that we looked at. That's great. I've done I've got what I came out. Or it could be that actually it's opened up some more doors and you've got more questions and there's other things that you want to achieve, in which case you might circle back and almost start that loop again, but looking for some more goals and outcomes. So yeah, it's sort of a bit of a loop, as I say, as that goes round. But the review part and sort of that evaluation is a really vital part, I think, because it gives us that accountability and also that knowledge that there has been change and forward momentum throughout those conversations.
Yeah, that's so well put, Sophie. Thank you for describing that so eloquently. Helen, what do you have to add to Sophie's explanation?
Yeah, no, I really like that, and I think we talk a lot about goals, don't we, in coaching? I think there's two things that I think about when I'm thinking. We often have 6 sessions to create that really trusting relationship, and what I often think about is a goal for that session and a goal for the 6 sessions. Where do we want to be at the end of this? But where do we want to be at the end of this hour as well? Where do we what we're heading for? And I've heard goals described as your North Star for the coaching session, which I think that's really nice. What I would like to say as well is I think there's no pressure to come with goals because we do talk about goals a lot. And as Sophie said quite rightly there, often the first 1 or 2 sessions is about formulating those goals, co-creating them with the client. And so really importantly for like some people have come to me and said, I'm bad at life. and, and they want to be better at life, and that's their goal. And obviously, that's something we need to dig into. But do you know what I mean? That's fine to come with that kind of just general, I think that's good too.
Thank you so much. We've got some really great questions in the chat here that I want to touch on. One of them, a couple of them come from Kate, who asks, can you please ask if coaching needs to be ICF certified to be successful? I will put that out to Sophie or Helen, whomever wants to answer that one.
Either, both, yeah.
You're both unmuting at
I
once.
think I think the answer is no, absolutely not. You don't have to be ICF certified to have a successful coaching relationship. Having said that, I am ICF certified and I value that quite highly. The problem is that anybody can call themselves a coach without any qualifications, and that's the issue. So if somebody has an ICF certification, then there's a level of learning there and a level of assessment there. But that doesn't mean to say that you won't find a good coach who isn't ICF certified.
Mm-hmm.
Yeah, I just wanted to add to that as well. I would agree. I think actually the important bit is that initial discovery and contracting phase that you as the person who is looking for a coach understands what level of experience and training that your coach has. And I don't think that necessarily has to be a specific ICF certification or specific qualification or whatever, but you need to be comfortable that whoever you are speaking to has an appropriate level of experience. Especially as we've touched on already in this discussion, there is often an overlap and often people coming for coaching may be experiencing some mental health challenges. So you want to be sure, as a coach, it's a real, I guess, almost an honor, but also, it's so important for us to recognize when our clients need something different from a coach. And I think sometimes, you need to make sure that the person that you are connecting with has the ability to do that for you. So, yeah.
Yeah, there's definitely responsibility on the part of the coach to make sure that the situation is safe and the individual is getting the help that they need, not just that it's another coaching client, but that we're here really to help. And if that means that we are not the best person for you as the coach, whether it's our background as a coach, what our niche interests are, or whatever it is, that we can recommend you to someone who would be a better fit or recommend that you do try to reach out to a mental health provider. I want to share a reflection that we have from Morgan in the chat, and then we'll come back to another question from Kate. Morgan says, I've been dealing with burnout and compassion fatigue for several years and left my job in January of 2024. I've been trying to recover these last 19 months and figure out my next steps because I don't think I can go back to traditional clinical practice. I've been seeing a therapist every 2 weeks since I graduated from vet school, but I feel very overwhelmed and not sure where to start whenever I try investigating other career options and haven't been able to make any progress in figuring out what to do next. I've been wondering if working with a coach might be helpful for me alongside still seeing my therapist, or if I need to wait to be better recovered from my compassion fatigue first before working with a coach. Um, I definitely have a response to that. And I'll just share my own experience and then I'll turn it over to Sophie and Helen, which is that, and we've talked about this as our Reviving Vet Med Coaching Collective, that majority of my coaching clients are concurrently seeing a therapist. That is part of their care, their maintenance, just as I see a therapist on a regular basis. And I find that the two can be quite complementary. I will leave that to Sophie or Helen to go into more detail, but that would be my initial response to that question. And thank you so much for your vulnerability in sharing, Morgan.
Yeah, absolutely. Thank you, Morgan. That's a very vulnerable thing to share with all of us today. So I would agree with Marie. I think often the two between sort of therapy and coaching can really work very well hand in hand. And from the way that you've described it in what you've said there is that you are looking to move forwards. And I think we touched on this earlier in the conversation where we talked about sort of a little bit the difference between counselling and coaching. And clearly you've been very dedicated and committed to working through the challenges that you've been experiencing, which is fantastic. And it seems to me like you feel like you are ready to start thinking about the future and to start thinking about making some changes. And actually, I think that's the perfect time to think about looking for a coach and working with a coach as well. You don't, as we've said, you don't have to have a clear idea of what you want in order to work with a coach. You might just be thinking, right, okay, there are some next steps that are here to be had, but I don't know what that looks like. And that's exactly what a coaching sort of conversation can help you with. We can help you understand those goals and things that you might want and really to help you achieve that clarity of what those next steps might be. So yeah, I absolutely agree with Marie. I think from the sounds of what you said, you may well benefit from working with a coach as well.
I think what I'd like to add to that is that we all on this call, coaches and counsellors, offer free intro calls, and they're free, and there's absolutely no obligation, genuinely no obligation to follow up, with sessions. And a lot of people have intro calls with multiple coaches and multiple therapists to see who the best fit is for you. And so I think if you're unsure, then talk to us. Like, we love to talk to you guys about this stuff. Book a call and we would love to chat to you.
Morgan has another great follow-up question, which is whether it's beneficial for certain types of coaching, like, for example, job career coaching, to work with a coach who's in your geographical region, since there may be regional differences in certain categories of things. I will speak to my own personal experience in that I wouldn't call myself a job or career coach, but as has been discussed, there's just so much overlap. You connect with somebody who's feeling challenged in their current role, whatever that may be, and it comes up in terms of, is this career right for me? Is it this particular job? Is there a circumstance within this job that I can fix, et cetera, et cetera? And I have had the pleasure of working with clients across the world, in the UK, in New Zealand, in Australia. And you can see that we have global representation here as well in terms of the US, Canada, the UK, and New Zealand. So I don't feel like there is a geographical need to be near your coach. 9 times out of 10, it is virtual, as we've discussed. But I do think it is important to connect with your coach. So if you feel that there's a disconnect, or maybe there's information that would be important for them to know, specific to your region, that you don't feel they quite have, I suspect that that will come out in your introductory call. And I'm going to open it up to if there's any more thoughts on that.
Sorry,
Oh,
go on,
sorry.
Kira.
I can jump in just real quick. I would say that when we're looking at career coaching or job coaching kind of things, it's not so much the specific job that we would help you find. It's more a matter of what matters to you
Yeah.
and what kinds of things you've done in the past that you absolutely adore and just cannot imagine a job without, and what kinds of things you don't ever want to do again. And that's going to be different for every person, and that isn't necessarily regional specific.
Yeah, I agree. And what I was going to say is I think the fact that we're all within the veterinary industry is probably more important than the geographical location, because there's some things that you just don't want to have to explain, to a non-veterinary person. So I find the fact that we're all in veterinary makes the conversation much easier, and it feels nice and trusting straight away often.
Yeah, absolutely. I'm going to go back to one of Kate's earlier questions, which is, as a coach, do you find challenges finding clients since you can't bill through insurance, whereas it might broaden your base if you are a mental health counselor? So I think that's a great question. And yeah, I don't want to jump in and answer the question. Is there anybody who wants to address that?
I can answer it a little bit. So there are different levels of licensure for mental health professionals, whether you're a social worker or you're a professional counselor or you're a licensed mental health. There are a lot of little delineations, and there's a lot of education that goes into each one. But there's also levels within those levels. So my license is not an independent license, so I can't bill directly to insurance. Whereas with coaching, I don't need to bill insurance. So in that way, this is a way for me to help more people than I'm currently able to help with my current license.
I would add on to that as well that oftentimes individuals, while yes, for coaching, they might be paying out of pocket, there are some extended health insurance policies, or even some employee assistance programs or health spendings accounts, depending on where you are in the world, that do cover coaching as part of their coverage. So it is worth looking into. And, we definitely want to make this as accessible as possible for everyone. So hopefully there will be some capacity to find some sort of coverage. And if not, then we're definitely happy to have a conversation, and you're welcome to reach out to me if there is a financial limitation that prohibits you from covering your coaching costs. I'm happy to have that conversation with you. Another great follow-up from Ashley as well is, what if we're considering some work outside of VetMed? So I think this goes back to the career coaching question. It's maybe what I'm gathering from Ashley is that, perhaps considering completely non-veterinary careers, and what that might look like. And when I read your question, Ashley, it's again, I go back to kind of what Kira said before, which is that we're not here to find you another job per se. We're not here expected to like have those connections and set you up with those things, but we are here to ask the questions and guide you to a place, or help you to find yourself in a place where you have that moment of recognition of what you really want to be doing, and then creating goals and steps from there in terms of, how do I get to that point? I've recognized where I want to be, what it is that I want to do, what that's going to look like, and now, how do we generate a plan together to get you there? Any other thoughts from the panelists?
I was just going to say, like, it's more about discovering your core values and figuring out what makes you you and who you are and what brings you joy in life. And sometimes we don't always know these things like right off of the get-go, and some people struggle to actually be able to name like what their core values are in life, and what gets them going and what motivates them and makes them happy, and within that. So it's that overall looking into that and helping you self-discover what is going to be right for you.
I think also a lot of us have personal experience of this transition, don't we? I don't do clinical work anymore. You know, I train and coach, so yeah, that absolutely. Are we considering leaving clinical work is something that we can personally help with as well.
So I'm going to put this question to Julie. When do you think that someone might be better served by coaching rather than therapy, and vice versa? Like if you're connecting with, let's say, one of your therapy clients, and I mean, you've got the opportunity to pivot, and you can, institute your coaching, skills within your therapy sessions. How do you know when, someone might be better served by someone else, for example?
Yeah, this is a great question. So, kind of broken it down between therapy and coaching. So, I think those that would be better served by therapy or seeing a mental health professional would be mental health concerns such as anxiety, depression, PTSD, other psychological conditions. Due to the therapist counselors being trained to address these deeper emotional and psychological issues. Like we already brought up earlier, past trauma. So, those that have experienced trauma, whether it's related to the work or their personal lives, can benefit from that therapeutic process because it helps them through the actual processing and healing from those experiences through a trauma-informed lens. Now, that being said, coaches can also become trained and trauma-informed as well, but these are looking into those deeper issues. Coping strategies. So, those that are struggling with unhealthy coping mechanisms or patterns, therapy can help to provide the tools to support them and to help them develop healthier strategies. Crisis situations. So, this was one that we didn't talk about earlier, but if that individual is in a crisis or experiencing overwhelming emotional distress, therapy can offer that immediate support and intervention, as well as being able to set up safety plans and stuff with those individuals. And exploring emotions. So this is a big one that can bring up a lot of things, and it's something that doesn't always come easy to all of us or the general population in general. Therapy is often focused on exploring and understanding emotions, which can be essential for addressing those underlying mental health issues that are there. And then for coaching, I'm probably reiterating some of the things that have already been brought up by Sophie and Helen, but that individual that's looking for a goal-oriented focus. So it's often more like coaching is more effective for individuals who are seeking to achieve personal and professional goals, such as improving work-life balance, enhancing leadership skills, or transitioning to a new role, which is, coming up here now, whether that's a new role within veterinary medicine or looking at just going outside of veterinary medicine altogether. Professional development also is an area that coaching can really help with. So someone looking to enhance their skills, increase their productivity at work, or navigate career changes like has been coming up here. So coaching provides that guidance and accountability that's needed within those areas. motivation and performance. So, we think about this in an athletic way, right? When we hear the word coach, initially it would always come up in an athletic sense, but it can be beneficial for individuals looking to boost their motivation, their accountability, the performance in their work without delving into deeper emotional issues, just keeping it on a surface level. Self-improvement and growth, support for change, all of those. Ultimately, the choice between therapy and coaching is going to depend on the individual's unique situation. And like we've already talked about here, a lot of people may find it very beneficial to seek both, like having a counselor, therapist, or a coach, because it can be beneficial.
That's super helpful, Julie. Very exhaustive list and very helpful for those who might be wondering. I heard you use the word trauma, and I know you and I have discussed this offline together. Kira, I'm wondering if you can maybe elaborate a little bit on what role trauma plays in the life of veterinary professionals. I think sometimes there are misconceptions there among those in the veterinary space, and how that should inform the kind of support that an individual is going to look for.
Yeah, this is one area that I lament on a regular basis that there's not more research. I'm sure everyone knows that there's huge research gaps when it comes to veterinary professionals, but I think there are several kinds of trauma that we're talking about here. I mean, it could be, a traumatic event that happened in your past, or a series of traumatic events that happened in your past that dictates how you're responding or automatically reacting to situations. And a lot of people in veterinary medicine can have that experience, and that kind of melds over into your work. If you've had these kinds of automatic reflexes, you can start seeing those automatic reflexes happening in your workspace, unrelated to stuff that happened in your past. So in those kinds of situations, I would say counseling is probably better for you, because getting to the root of why you are reacting the way you are is probably more appropriate in those situations. But on the flip side of that, we all see secondary trauma almost daily, I would say. And that can come out in compassion fatigue or burnout, or and it can come from seeing an animal in pain. It can come from, experiencing clients' pain over and over again. So those kinds of immediate stress are things that coaches can help with immediately. And we can talk about what's happening in your day-to-day lives. I do think that euthanasia always comes up in the public as probably the most traumatic event veterinarians feel. But when I talk to veterinary professionals, that's not actually the most traumatic thing we see. I think a lot of people see it as a gift that we can give to patients. I think people find more traumatic events from being unable to help a patient, or how clients are treating us, or relationships with our coworkers or leaders. Those sorts of things are way more stressful in our day-to-day lives. And that's certainly something that coaching can support and help you kind of work through of how you want to handle it currently and move forward in your career and make it a fulfilling career.
Yeah, I love that. Very well said. It's so interesting. I did a lot of research in preparation for my book around euthanasia and the public's perception of that and the veterinarian's experience with that. And there was research that came out of the Ontario Vet College demonstrating that it's not the actual doing the euthanasia that impacts well-being. It is the conversations leading up to the euthanasia that really can have a detrimental impact on the team. So dovetails nicely with what you said. And there are so many trauma experiences or trauma-like or secondary trauma experiences around, not feeling like you can't euthanize a pet when it's time, or, witnessing family conflict that results in not being able to make a decision about euthanizing a pet or whatever it might be. So I love that you brought up euthanasia. That's definitely something that we often are discussing in our work. I want to shift gears for just a moment and talk about psychological safety. and building psychological safety and really trust in these relationships, whether it's coaching or therapy. Sophie, did you want to comment on that?
Sure, absolutely. And I think we have already touched on this earlier when we were talking about sort of the coaching or counseling relationship. Obviously, I'm coming at this from the perspective of a coaching relationship, but feeling comfortable with your coach, feeling like you can open up to them, and although on the surface level, sometimes some of the things that we initially talk about within a coaching relationship can be sort of, not that emotional or not too deep. Actually, sometimes as that relationship progresses, we can start actually figuring out that there are some barriers that exist to us moving forward from things that we have experienced in the past, and that can take quite a lot of courage to discuss in those situations. I think in terms of our responsibility as a coach in building that, I would say any coach has that responsibility of confidentiality for a start, and particularly I often get questions around if you're coaching somebody in the local area. The veterinary profession is quite a small profession, and I think sometimes people are concerned that if they come to you and talk to you about things that are going on at work for them, that's something that you may end up, or actually you might know somebody who works in the practice, you might be friends with somebody else in that practice, but it's that reassurance, and just talk to your coach in those initial conversations, and tell them your concerns about that, and your coach is bound by confidentiality in those conversations, and hopefully can give you that confidence that you need, that those conversations are between you two. And again, I think we've touched on it throughout this. It's about having those initial conversations, knowing what sort of level of experience your coach has, and sort of trusting them that they'll be able to direct you to the right place if there's other help and support that you need as well. So I think that's quite important to recognise.
Julie, what would you like to add to that?
So coming from the counseling perspective, I'm going to say, like, right from the get-go, promoting that confidentiality and making sure that your clients understand that what is happening in session stays in session is completely confidential. There are limitations to confidentiality when it comes to counseling. Obviously, ethically and legally, we're bound to report under certain situations, but again, there's always going to be conversations about that with the client prior to that ever happening, and having that discussion right from the get-go, like, so within very first session, laying that out on the line, talking about it, making sure that the client fully understands that is so crucial and important, because it's going to start to build that trust and encourage that openness that happens within it. Again, right from the get-go and right from within the beginning in first session, establishing clear boundaries. So really clearly defining the roles of what the counselor, what their part in it is, what the client's part is, setting those expectations of of coaching and therapeutic relationships helps the client be able to really understand better the scope of the work that you're going to be doing together, and feeling secure within that process, creating a welcoming environment. So, and a lot of people will say, well, how can you do that, virtually, when, you're not sitting right there with the person? But it is very easy to do, like, with, how you're presenting yourself, and how you're coming across. Being genuine and authentic is going to really encourage that individual to have free expression as well. And it helps them feel comfortable opening up about their own challenges when you're able to be authentic with them. And encouraging open communication. So, like, within that, like, fostering that environment is going to make them more comfortable with sharing their thoughts and feelings, and feeling psychologically safe, like within that process. And one of the big things, and and something that I practice all of the time, is encouraging feedback from my clients. I want to know, like, I want them to know that I value their opinion. And if there's something that has come up that, you know, they feel that they need to share, I want them to feel comfortable doing so, right? So, and setting realistic goals with them. It's a collaboration. Like, it's not me dictating what needs to be done. It's us working together and talking about things. And I will often say, like, you're the one driving the bus. I'm here to, be your navigator and help you along the way, and maybe help you not miss a turn here or there. And I think most of all and above everything, empathy, right? Having that empathy for the individual that you're sitting with is really going to develop that safety and that comfort.
Yeah, such beautiful sentiments, Julie. Thanks for verbalizing those for all of us. Well, I could chat with all of you all day, and I know we could talk about so many more topics. One of the things that is of particular passion for me is stigma reduction, and I know that there is huge stigma around mental health support, really any kind of support, any sort of help seeking. As caregivers, we feel like we need to do it all on our own and just figure it out ourselves and put our nose down and push through. With the few minutes that we have left, I'm going to put it out to each one of the coaches and also our co mental health providers who are on our panel as well today. What's one piece of advice you would give to somebody who is unsure about whether they should reach out for either mental health or coaching support, right? There's this feeling of, like I'm not that person that needs this. How do we overcome that stigma? And what would you say to them? And I'll start with you, Helen.
Yeah, I just think it's really normal to need coaching support or therapy. I've had both. I've benefited massively from both. And I think the more of us that stand up and say, I've done these things and it's helpful to me, the more we can normalize it and the better it is. And as I said before, we'd love to talk to you and book an intro call just for fun. Like, it'll be nice.
Thanks, Helen. Over to you, Julie.
So, I mean, I know this feeling well. Personally, I remember feeling absolutely terrified when I was navigating, trying to reach out for help myself. And I would echo what Helen said. It's normal. Like, it's completely normal to feel afraid or hesitant. And just to let you know, you're not alone in feeling this way, right? Many people within the field of veterinary medicine experience like these similar fears. And I just want to put it out this way. Like, think of it, in the way, like, just as you care for the animals and the people that you serve, that it's vital to care for yourself. You deserve the exact same compassion and support that you offer to others, and you matter, and well-being is important.
I love that. Sophie?
Yeah, absolutely echoing everything that's already been said. But I think it's really important to recognize as well that you don't need to be in crisis to seek the support of either a coach or a counselor. We don't need an excuse to look after our emotional health. We don't need to have some reason to justify why we want to feel better or to grow or get stronger or have goals in life. So our emotional health isn't, it's not a side quest. It's not something that we sort of only do when we're worried that it's not in the right place. It's not an extra thing to do. It's central to us thriving, and we can seek that support at any point in our lives. So yeah, I think just any coaching or counselling conversation is just about opening doors, having that curiosity to look into yourself and that sort of sense of self-discovery.
Awesome. Last but not least, Kira.
Yeah, honestly, this panel is just a remarkable group of women. Like they say everything just so beautifully. I would echo everything that everyone else has said, but I'd also say, making the time for ourselves is just such an important part of life. And as others have indicated, it's not necessarily about pulling ourselves out of a hole. Sometimes it's about lifting ourselves up a mountain and getting to that thriving part of, hey, I can be better and I can be happier, or I can live a more fulfilling life. I can reach some goals that I've been trying to reach. And sometimes you just need a little extra hand to do those things.
I couldn't agree more. I definitely have been an individual who has utilized many different supports, I should say, in my life, from acupuncture to naturopath to physician, therapist, and many different types of coaches, including business coaches, life coaches, wellness coaches, and so on. And I feel like once you exercise that support muscle, you really do start to recognize, like, okay, I need a conversation, and I need that conversation to be with somebody who's not in my inner circle. Like, I need that unbiased, unfiltered, special relationship conversation that we really only get when we have these trusted relationships with mental health professionals and coaches. So, this is so wonderful and so helpful. Thank you so much to all of our panelists for today. I've got thank yous in the comments section as well. We are so glad that we could have this conversation and answer these questions. And I look forward to connecting with all of my coaches again soon, and also hopefully some of you that are listening. So have a wonderful rest of your day, everybody.